athletic training. Now, sports medicine, as you know, isn't just about athletic training. And we'll put the video that we watched at the end here, but it'll be available to you. However, I want you to know that the definition of athletic training as a discipline within sports medicine, because most of us will act in a capacity similar to athletic trainers, whether we are or not. And if we are acting as an athletic trainer, you are subject to the standard of care for which an athletic trainer is subject, which means a lot of things. It means that you are subject to the information that any certified trainer, more than likely, dependent on your state, the certifications of the trainer required by your state, or perhaps ACS or NATA's certifications for trainers. Those standards apply for you if you act using the responsibilities or with the capabilities of an athletic trainer. So an athletic trainer or athletic training is practiced by athletic trainers and healthcare professionals who collaborate with other physicians and members of the sports medicine team in order to optimize activity and participation of both patients and clients in a variety of settings. The athletic training discipline encompasses prevention, diagnosis, intervention with regard to emergencies, acute injuries, chronic medical conditions that involve impairment, and functional limitations, as well as disabilities. So if you act in any of these roles, you are actually acting in the discipline of athletic training. Now again, the video will be in this section, will be at the end of the slideshow, but make sure you review the video at the end. Also, your assigned reading for Wednesday, January 18th is chapters 1, 5, and 6. Make sure you read those chapters and you are ready on Wednesday. There may be a quiz. Now, I do want to talk a little bit about the sports medicine team. As you heard in the video in class, or you may watch at the end, the sports medicine team is not just athletic trainers. It's a variety of individuals, and all of these people on this list can be a member of your sports medicine team. It's important that you're able to work collaboratively with all of these people. Now, an athletic trainer specifically can be a lot of different things. However, the gold standard athletic training is an athletic trainer that is a BOC trainer, meaning they are certified by the Board of Certification, and certified athletic trainers have fulfilled the requirements for certification established by the National Athletic Trainers Association's Board of Certification, Inc. That's the NATA BOC. National Athletic Trainers Association is NATA, and then the Board of Certification. NATA BOC Trainer. The certification examination is administered by an NATA BOC certified or credentialed organization consisting of a written exam portion that has multiple choice questions, a practical section that evaluates the psychomotor skill components of the domains within athletic training, a written simulation test where athletic training related situations are designed and proposed to you to approximate your real life decision making skills in a written format. Now, when we talk about that BOC trainer, that's any allied healthcare professional with extensive education in clinical care and the prevention of sports injuries. Most must go through a formalized program. At this point, everyone who calls themselves a BO or can sit for the BOC exam must go through some sort of a formalized program, either undergraduate or graduate. And the domains in which you're examined for on the BOC exam are injury prevention, recognition, evaluation, and immediate care of injury, or actually illness as well, treatment and rehabilitation, as well as healthcare organization and administration, professional development, and your responsibilities therein. So who can sit for the exam? Now, the Commission on the Accreditation of Athletic Training Education created the Joint Review Committee on Educational Programs in Athletic Training, and that was incorporated in 1991 in Texas. Now, this Joint Review Committee for Athletic Training, the JRCAT, was a committee on accreditation under the Commission of the Accreditation of the Allied Health Education Programs, KHEP, which is the same organization that accredits us through our ACSM knowledge, skills, and abilities. Now, in June of 2006, this committee, the JRCAT, became independent from KHEP, so it broke away from the organization that credentials our programs, and it changed its name to the Commission on the Accreditation of Athletic Training Education, or CAATE. The CAATE is an educational agency that's responsible for the accreditation of 360 professional entry-level athletic training programs. The American Academy of Family Physicians, the American Academy of Pediatrics, the American Orthopedic Society for Sports Medicine, and the National Athletic Trainers Association cooperate to sponsor the Commission on Accreditation of Athletic Training Programs, and collaboratively, these medical organizations and medical professionals develop the standards for entry-level athletic training education programs. In order to then sit for the exam, you have to have completed one of the programs that are accredited by the Commission on the Accreditation of Athletic Training Education, KAATE, and those programs are called ATEP programs, Athletic Training Education Programs. They can either be undergraduate or graduate in nature. And then, once you've done that, you can take the certification exam that's now offered by a national network of computerized testing centers outside of the practical skills, which you take in a separate form. And of course, you also have to complete several clinical hours. Now, once you complete your program, you take the exam administered by the BOC. The exam does not determine the overall quality and the skill level of the individual, or should it be the final educational goal of the student. The BOC requires that certified athletic trainers achieved at least 75 continuing education units during a 3-year span. Now, I will tell you that many of the conferences that we go to on a regular basis have these CEUs, which are continuing education units. Generally, a 3 to 5 day conference, you can acquire anywhere from 25 to 50 continuing education units, which also means that you really need to plan on going to a professional conference or participating in some sort of educational webinar, perhaps a lot of webinars. You need to budget the cost of that in your professional budget so that you can maintain your certification. So it costs money to maintain your certification, because you have to invest in your continuing education. So now you ask, how do I become an athletic trainer coming from A&T State University in North Carolina? Well, you have the graduate school option. You're well prepared for graduate school coming from our sports science, fitness management curriculum, and graduate degrees actually provide additional employment opportunities. 70% of athletic trainers, in fact, have a master's degree or a doctoral degree. So colleges and universities may often as well offer graduate assistantships, which means you're training to become an athletic trainer. You're working for the university, and in turn, that work is rewarded with tuition, fees, stipends, money to live on. And graduate assistantships are a great way to get through a graduate program in athletic training. Now, there are fewer graduate programs than undergraduate programs, but we do have one right here in the area at UNCG. And it is an ATEP program, which means what? Accredited by, you guys remember, the Commission on the Accreditation of Athletic Training Education, that joint committee that put together the standards along with the other professional organizations for the NATA programs. So, we've got a lot of options.